able to check around your breast in cycles, in a circular motion, to be able to check if there's any abnormal swelling, abnormal tenderness, or is there like abnormal secretions. Welcome back to today's episode welcome back to our health series, and we'll be discussing a very important topic today: screening for female health is very important to me. As a woman, when last did you have any screening done? Like, when last did you have like any screening? Do you know that there are some screenings that are very important for you as a woman? Yes, I mean, very important screenings, and especially women between the ages of 18 and 45. Health screening for us is so important, and regular health screening plays a very crucial role in early detection and prevention of various health diseases. All right, so it's very essential to prioritize our health and well-being by scheduling regular health screenings. We can take proactive steps toward maintaining good health, and there are some health screenings I'm going to be talking about for us as a women, especially between the ages of 18 to 45, or if you are a sexually active woman. These health screenings are very important. First of all, let's talk about Pap Smear. Do you all know what Pap Smear is? Pap Smear is it helps to detect abnormal cervical cells and the presence of human papilloma virus, which is called HPV. So Pap Smear or HPV testing is a type of whoever does that, the test, either the midwife or the health personnel that is doing the test, takes the sample from the cervix. It's like a swab around the cervix. Okay, so this test is sent off. This Pap Smear test can help to detect any abnormal cervical cells and any presence of HPV, and because cervical cancer is a leading cause of cancer in women, so the frequency of testing is very important. It depends on individual risk factors. So starting from the ages of 21, this Pap Smear test is recommended after the age of 21. If you're becoming sexually active, a woman, you must have at least regular Pap Smear test. So this test it can be done every 2 years or every 3 years. So second test I will talk about, this screening is very important: breast health examination. When last did you check your breast? You can do this yourself. You don't need to go to any clinic, or you don't need to go anywhere. Breast health examination is another very important screening that you should incorporate into your routine, like your general regular health screen. And do a monthly breast self-examination and what your breasts look like, and so that if there's any abnormality you can easily detect at the pin of eye. All right, so monthly breast self-examination, becomes familiar with the look. Your clinical breast examination can be performed by your healthcare providers every 1 to 3 years, depending on your risk factor. Also, in some situations, mammograms may be recommended for some women. So regular breast examination, you have to be able to palpate your breast, and you have to be able to check around your breast in cycles, in a circular motion, to be able to check if there's any abnormal swelling, abnormal tenderness, or is there like abnormal secretions or things. Those are the things you can check when you do regular breast examination. And also sometimes women that does regular breast examination, they're able to detect early breast cancer. So if you are very of high risk factor, family members or anything, I would recommend you do a regular breast examination. STI testing, these are for women or female that don't have like one partner. You have like maybe multiple partners. I would recommend you do a regular STI testing, because STIs such as chlamydia, gonorrhea, syphilis, HIV are very common. And also safe sex practice is important if you are like sexually active. Talk about is blood pressure management. Do you know that checking your blood pressure can help you monitor if you are at risk of hypertension? Also, because hypertension is one of the leading risk factors for heart disease, for stroke, and maintaining a healthy lifestyle, balanced diet, regular exercise, stress management techniques, all this will help to maintain your blood pressure. So ensure you check your blood pressure at least every 6 months. You should be able to know what your blood pressure says. All right. And also monitoring of your weight, your BMI. When you go for your check of the blood pressure, make sure you check your weight, your BMI, and all that. All right. Let's talk about some blood tests. Blood tests, some routine blood test is important. Also, you can use that to assess your cholesterol levels, blood sugar, and there are some important markers that are also in the body that can help you detect if you are at risk of probably heart condition, or you are at risk of any heart condition also. So blood tests can help you to detect diabetes, heart disease, or any metabolic disorders. All right, so doing a regular blood test is also very, very important. Bone density test, this can be done in some women. It's recommended for them density test. Some women as they age, they start having all this bone pain, osteoporosis, pain in the neck, arthritis. Some women are at risk of arthritis than the other. So bone density test can help you detect any of these as soon as possible. And starting from the age of 35, this bone density test will help you to evaluate your bone health and assess the risk of osteoporosis or fractures or anything. Bone density test is good as you age. This can help you to monitor that. Some other tests that is also important: blood sugar checking, just like I said, blood pressure checking, your breast examination. Breast examination is very important. HPV, that's Pap Smear testing, and also monitoring of your BMI and weight. All these are like very, very important tests you should consider as a woman. Alright, thank you for watching my video. I'll see you in my next video. Don't forget to subscribe to my channel. My name is Rose and I blog on nursing, health, fitness, and lifestyle generally. Alright, I'll see you in my next video. Bye.